We're talking about direct-to-implant breast cancer reconstruction. It is a newer technique that's probably been used for the last 2 to 3 years here at St. Elizabeth's Breast Cancer Center. It has a significant advantage for women. In the past, when you used an implant for reconstruction, we would place a tissue expander, and that tissue expander would stay in place for several months and require a secondary operation that ladies would have to go through to get their final reconstruction. This technique, which I don't think anyone else in the state is using, goes direct to implant. So when the patient leaves the hospital, they have their reconstruction.
We utilize the newer techniques that are available, whereby we are using collagen grafts and other materials that allow us to eliminate in a lot of instances the need for tissue expansion and intermediate stages. Traditionally, reconstructions would take, they may run 4 or 5 months altogether. But now we have people back playing tennis and golf inside of 4 and 5 weeks.
This current procedure more closely simulates what we do for an augmentation surgery to make the breast larger, which happens on an outpatient basis. So a lot of women can come from an outside area.
We see a lot of patients from outstate Nebraska, northern Kansas, western Iowa, even up into South Dakota.
We have some of the most experience around. When you talk to the people who do this, we have the same numbers as some of the major metropolitan areas.
There are other surgeons in the country that certainly do this, but in the immediate area, I'm not aware of anybody else that does this. And I would think this would catch on pretty quickly because it just offers the patients such a wonderful and much speedier recovery.